In March 1990, you could get more information about buying a car than you could about comparing hospitals. That changed a month later, when America's Best Hospitals appeared in the April 30th, 1990 issue of U.S. News & World Report. It was the first time the media had given the public a tool for deciding where to go for hospital care. We created Best Hospitals for one simple reason. A fraction of hospital patients, one that looks small but adds up to a very large number, need a very high level of hospital care, and we started Best Hospitals for them. What that means is this. Most hospital patients are outpatients who get same-day care, or inpatients who get relatively routine care, like a hernia repair or knee replacement. But for Best Hospitals, we want to know how well hospitals do with high-risk inpatients and complicated operations. So we screen out everyday patients and procedures. We run some 5,000 hospitals through analysis, sifting through statistics that show patient survival, hospital reputation with specialists, patient safety, and more. We evaluate hospitals by specialty, not by particular conditions or operations. They're nationally ranked in 16 adult and 10 pediatric specialties. So let's say you come to usnews.com because you're looking for the best hospital for knee replacement. Do you really need a nationally ranked best hospital? If something about your health makes you more risky than most for knee replacement, the answer may be yes. But if the hospital you have in mind does lots of knee replacements and does them well, probably not. The best way to start is to visit our pages for your metro area or state and see how hospitals near you perform. Are any of them nationally ranked? If not, are any of them in the high-performing category? We call these hospitals best regional hospitals. They represent the top quarter of all hospitals that made it through the same tough screening the nationally ranked centers did. When you dig into the information on a particular hospital's page, you'll want to check survival and reputation, but also pay special attention to the numbers of patients and/or procedures too. That's because volume is one useful indication of expertise. Like every other difficult activity, the only way to get better at a procedure is to practice doing it. The process is the same if you're looking for a children's hospital. Some childhood illnesses and conditions require the kind of clinical expertise only available at an outstanding pediatric hospital. The U.S. News Best Children's Hospital Rankings, launched in 2007, provide a robust set of measures for evaluating pediatric care. For the adult rankings, statistics are available from the federal government, the American Hospital Association, and other sources. For Best Children's Hospitals, however, we have to get most of the information directly from the hospitals. That's because large pediatric databases either don't exist or aren't open to the public. There's also an honor roll for Best Hospitals and one for Best Children's Hospitals. The honor rolls recognize hospitals with high rankings across many different specialties. They speak to a culture that demands excellence. If the hospital where your doctor says you should go does not appear in Best Hospitals, that does not mean it isn't right for you. Ask your doctor, why are you sending me to Big City General? There may be a good reason. If you're not convinced, follow up by asking about a hospital you learned about on these pages. Best Hospitals will have more to offer in the coming months and years. We're planning new ways to rate hospitals, for instance, in routine care that is typical of the reasons most people go to hospitals. We have much more information available on usnews.com for helping you make other healthcare decisions, such as choosing the right doctor and health insurance plan. How do you think we can improve or add to our roster of healthcare tools? We would welcome your thoughts. Please send them to healthfeedback, that's one word, healthfeedback, @usnews.com.